Well, good morning everybody, thank you for coming. My name is Jane Stevens and I'm the founder of GreenTara Trust in the UK. So today we're going to present two case studies, one from GreenTaraNepal, which I will present. Then my colleague Pharphing will present some findings from Nepal. Edwin will talk about the curriculum. Padam will talk about a national level policy. So altogether we'll be here for about 40 minutes. So you may ask, why health promotion? So in 2005, Padam and I looked at what we felt was missing in Nepal. And we felt that there was a knowledge gap in preventative health measures in Nepal. With no clear health promotion training, no national policy. So we wanted to contribute to that. And particularly for a very poor country like Nepal, where there is a significant burden of disease that is preventable through health promotion, we felt that this was an approach that would be very beneficial for our country of Nepal. And just to remind ourselves of the Bangkok Charter of Health Promotion for 2005, it tells us that if we want health promotion to be moved forward on the globalised agenda, this requires political action, broad participation and sustained advocacy. So the basis of our programme is highlighted on this slide. I just want to emphasise that our approach is women's-based, community-based, and we use the government and local stakeholders and what is already available as much as possible. We have two areas of projects, one just outside the Kathmandu Valley and one in Nepal. So I'm going to talk to you about the purpose of the programme in GreenTaraNepal. So our approach really is that we feel that good quality evidence needs to be collected in Nepal, and this should not just include household surveys, it needs to include qualitative evidence, case studies, and lessons learned from the implementation of programs. And part of our job as health promoters is to create spaces for us to dialogue like today, for people from the field, from district level, from national level, from international level, to all get together and share our lessons without there being any hierarchy and it all being equally valuable. So the goal of this programme was to assess the effectiveness of the community-based health promotion interventions, particularly in improving maternal health behaviour. So we used the health promotion cycle and started with a needs assessment, which was quite an extensive process over 2 to 3 years, starting in 2005. We then went through the programme planning, implementation and evaluation. So I'm going to talk a bit about the preparation. Padam and I did a literature review in the UK of the international literature and Nepal literature. We then came to Nepal to look at the grey literature. We looked at existing health promotion interventions and then had meetings in Nepal between the UK universities, GreenTara Trust in the UK and our partners in the Ministry of Health and Education and medical colleges and universities in Nepal. We then reached an agreement to run a pilot health promotion project. We identified 6 potential areas. We set our objectives and outcomes. We then got approval to do the intervention. We chose one intervention area based on how keen the community were to work with us and developed a theory of change. We then went to the community and did community priority setting with them, and they wanted a maternal health and women's empowerment intervention. We then did a needs assessment, starting with a qualitative review, then a household survey, and we had a lot of support from Masters and PhD students in the UK. We then renegotiated our priorities with the community and set up the intervention. So this was a quasi-experimental design. It was a controlled before and after study. So this is a little picture. just to outline how we did this. So we had an intervention group in GreenTaraNepal And we matched this to a control area in the southeast of Kathmandu. And we did not put the intervention into the control group. We then did the intervention over 5 years, and we collected the data again in both communities. And the idea of this was to be able to see if our intervention had had any effect. So I won't talk much about the intervention, but there were two components. It was mainly a community-based intervention with 2 health promoters who are both here today, over there somewhere. There they are. Minister Nishwari, say hello. And partly a health systems strengthening intervention. So just to share some results with you, I'm going to share some statistically significant results. So you can see here, these are results at time 0 and at 5 years. And there was a significant improvement in women coming from 4 or more antenatal visits in the intervention area compared to the control area. Use of clean delivery kits actually went down in the control area, but really improved in the intervention area. And this is likely due to women's groups making their own safe delivery kits and promoting them throughout their own networks. Women's decision-making in healthcare was asked as a question, as a measure of women's empowerment. And this didn't change in the control area, but it improved in the intervention area. This was a knowledge question, really, about health, around whether or not termination is legal in Nepal. And there was a slight improvement in the control area, but a much bigger improvement in the intervention. This slide shows you the benefits of having a control community. So, in the middle of our intervention, the government had a campaign to push tetanus toxoid vaccination throughout Nepal, and there was a great improvement in both the control and intervention area. And the difference between these two was not statistically significant. So if we'd only done this in the intervention area, and you looked at the graph on the right, you may assume that the intervention had caused this improvement, and you would be wrong. So to conclude, prevention is better than cure. Health promotion is a very simple and low-cost, community-based intervention that is effective in Nepal, and we feel it is best to combine a theory-based approach with a community-based approach to do this. Thank you for your attention, and if you'd like to read more about this study, it's published in an open access journal that you can all download.